Good afternoon. I'm Reed Humphrey, Dean of the College of Health Professions and Biomedical Sciences and head of Health and Medicine. And just want to thank you all for coming. I want to especially thank Mark and Cheryl Burnham for being here, the reason for being here, President Bodner, Friends of the Foundation, faculty, staff, students, media. We very much appreciate that you take a few moments on this day to join us for some really good news. I think there's no greater social duty than to care for those suffering from injury, illness, both physical and mental illness. And the social and economic burden of premature chronic disease and disability is something that weighs on all of us and will affect all of us well into the future. And this college and other units on this campus at the University of Montana are dedicated to finding solutions, not only in the broader perspective, but specifically for Montanans and people of western Montana and the region. We have a very special commitment to rural and underserved populations, and the gift that we're talking about today, really an investment, is in our ability to be innovative, to find new ways to manage premature chronic disease and disability, and to really extend both the university's reach but our caregivers' reach into places that desperately need us now and more so in the future. Many of you are aware through past publications that we need at minimum 16,000 new caregivers in Montana over the next decade, probably 8,000 new positions, and to replace those who are going to be retiring. And much of that need focuses on rural areas where healthcare is often inaccessible to many, and the problems unique to those communities. This gift, through investment in areas such as population health and encouraging clinicians to practice in Montana and especially in rural areas, is a major step forward. But it is more than a gift; it's an investment. And I know Mark and Cheryl are looking to me and to all of us to leverage that investment in ways that will really move healthcare forward in this region. A couple of years ago we created the Health and Medicine initiative to bring a lot of campus initiatives under one umbrella. And since then we've grown in scope, partnering with healthcare providers across the state and locally to drive innovation and to meet the need for healthcare workers. We want to train professionals to have successful lifelong careers serving their fellow citizens of Montana and across the region. Today we're pleased to celebrate a gift that will further grow this important initiative. And at this point I'd like to introduce my colleague and direct supervisor, President Seth Bodner, to the podium. Thank you.
Thank you, Dean Humphrey, and thank you, everyone, for being here today. This, there's a lot of things that you get to do as a university president, and sharing great news like this is among the best. Because today, I get to share with all of you that the Madrona Hill Foundation has committed $1 million to support UM's Health and Medicine initiative. This is a fantastic. And, when you think about this university, when you think about this community, one of the things that strikes me is not just the importance of health and medicine, but the opportunity for this community, for this university. Missoula is a large population center. It's this state's second largest city, and the surrounding areas are really the version of a Montana metropolis. We also have fantastic medical care, medical facilities in this city and in this area, and we have a world-class research university with great depth in health and medicine. The intersection of those three things in one location is a tremendous opportunity for this university. I think what Dean Humphrey and the team have done in creating the Health and Medicine Initiative and really expanding that scope is tremendous. And we have a wonderful opportunity to expand our focus in this area and really establish the University of Montana as the health and medicine university, not just in the state but in this region. We have that wonderful opportunity, and the today's gift and the generosity of Mark and Cheryl Burnham is just phenomenal in helping us move that vision forward. In the first year, the Madrona Hill Foundation seed funding will help launch an occupational therapy program that's actually being done in collaboration with MSU Billings. This is a great program, and it meets a growing need for occupational therapists across this state. And the ways in which we are working with MSU Billings, I think, are a great example of the way that this university serves all Montanans. The gift will also establish and fund the Burnham Family Population Health Fellowship for our doctoral students in public health, as well as the Burnham Family Practice in Montana Scholarship. So both of these meet, again, very important needs of the community. You think about population health, you think about the emerging diseases, the need, the desperate need for people who can understand and assess those challenges at the population level. And in terms of family practice, as Reed alluded to, the needs for quality care in rural communities and for people who are focused on meeting that need are astounding. And their transformative gift will absolutely have an impact on Montanans, not just on the students that get that gift, but it is a gift that will be given through those students to the many people that they will serve. And we couldn't be more thankful to Mark and Cheryl. They have been great supporters of this university and continue to be so. So I am honored to get to announce this gift, and even more so to get to bring up Mr. Mark Burnham to say a few words.
This is cool. So Cheryl was a pharmacy student here, graduated here in 1986. That's probably the base reason that we kind of started to seek out how could we empower the university to be better and great. So we really started our philanthropic gifts to the university in 2007 through the Madrona Hill Foundation, which is a private foundation that we established back in 2007. And with that, one of the initial things that we did is we funded the Pet and Auto Fellowship, which allowed the pharmacy to do a number of things. One of those was the iFarm program, which is really focused on delivering care to rural Montana, which, as we know, we have a very, very big state, and we do have these little cities around, but there's a lot of places outside of there that really need to be provided and served, and that was a big part of what we did. So we started a conversation with Reed, homecoming of 2016. And, you know, Reed's a cocky, very self-assured person. and so what we said is, Reed, he's telling us all the things he can do for us. And I said, why don't we break this down? If we give you $1 million, what are you going to do with it? We give you $1 million, what are you going to do with it? That's 18 months ago. Okay? So we kept talking, and Reed had me down to Plonk one afternoon. He was playing with Manhattans, and he says, I think we're ready. And I said, well, when we get a piece of paper in front of us to see what this looks like, we'll start talking about it. And lo and behold, Reed's come up with what we think is a fantastic opportunity, and obviously we're in. But the thing that's really, really important is, I think in this day and age where, you know, we're
having our challenges at the University of Montana, because I don't think people really understand the value of a strong liberal arts education and how that works with everything. And prior to me coming over here, I bumped into Klaus from the business school because we were visiting about some things. The partnership that the business school and the pharmacy and the health and medicine group have, it's phenomenal, right? And we're now finally not being sad, and we're starting to tell our story, right? We're advocating for the things that we can do and do well. And I think this is fantastic, and this is just another example. One of the great things in setting up this fund is this fund's available for everyone in this room to throw some money in, because we're going to like what they're going to do. And it's going to provide them that strategic investment capital that we so need. But let's not kid ourselves. For the university to grow and prosper and be good for the long term, it's going to take the private donors to make that happen. The state's only got so much money, right? It's our obligation to do those very things. So that's that piece of it. So Reed used the word leverage. I might have inverted the word leverage. You know, I might have invented that at some point in time. So I think it's really, you know, first and foremost, from the Madrona Hill Foundation aspect, this is a way for all of the members of the Madrona Hill Foundation to honor Cheryl and our family, to honor you, and how she was able to be completely committed to her family but still practice pharmacy while I was learning how to figure out how to make a buck. And really, it was such a great baton handoff when she's like, we moved to Oregon, she said, do I have to keep doing this? Because I'd really like to focus on the kids. It's like, go, let's do that. So we've been able to do that since about 2000. It's been one of the best decisions we made. We have great kids to show for it. The kids are now active with us in the foundation, and we get to do this together. So that's that piece. So, the other thing is, you know, it shows, even though we don't live in Montana, the commitment and the love we have for Montana, all parts of Montana. If you're in Webo, Montana, or if you're in Glennywood, or if you're somewhere else, just come to a Grizzly football game on Saturday and see where everybody comes from, because they love this place, right? So with that, I don't really have much more to say, but I want to say thank you for being a Grizzly, and thank you for believing in Montana and believing in Missoula. Thank you very much.
Thanks, Mark, and Cheryl, Seth, and all of you for being, not just being here, but being part of the UM family. It's you know, as I like to say, I can wax that way. I'm going to leverage your comments to just say, you know, so I grew up in Pittsburgh, and it took me a while. I came through Montana when I was 22, and actually wrote down Missoula, a pretty cool place I could live here, and it took me a few decades to find my way back. But you know, it's a special place, and the opportunity for us to take this investment and build upon it to solve really important healthcare issues in Montana, some of which we haven't even discovered yet, is a huge step forward for all of us, I think. And so I couldn't be more appreciative. It's been actually a pretty fun 18 months, but I'm looking forward to the next 18 months. You know, as you might imagine, I'm super excited about now having the opportunity to take that gift and begin to build out really important programs and services and innovative ways to reach rural areas. So, my promise to Mark and Cheryl, among many, is some of which I hope to keep, is to leverage that gift in ways that are that will build out the reach of this university. I just finished by saying that solving healthcare issues, testing hypotheses on new ways and new ways to reach and make impactful change, especially in rural Montana, only can happen at a university. It can happen at a healthcare center who are busy taking care of patients, and it really doesn't happen in other places. It's the young minds and the expertise of faculty that work together with research teams that can be a really meaningful part of the community and the region in ways that just can't be accomplished anywhere else. And that's kind of what's cool about being at a university. So with that, I will thank you all again for being here. I know that Mark and I, and perhaps President Bodner will be around for a few moments to talk to the media. But thanks again, Mark Sherrill Foundation, President Bodner, and others. And with that, have a fabulous day and spring break ahead.